What's going on, everyone? I'm Adam, and welcome back to the MedLife. Today I have with me
Maddie.
George.
and myself. And today we're going to be talking about doctor versus PA versus nurse. Is it more than just a title? How does it actually work in the hospital? We're going to talk about all of that and answer some of the most common questions in today's video. The first thing I think we should talk about is schooling length. So how long is everyone's schooling respective? I'll start because it's easy. You need 4 years of college, 4 years of medical school, and then anywhere from like 3 to 7 years of residency. And then even more, you can do a fellowship for another 1, 2, 3 years or more. So that's how many years. It's a long time. What about PA school? It's more reasonable.
So PA school, it's still 4 years of undergrad, and then the average PA program in the United States is 27 months. My program is 27 months, but it can range from 24 to 33. And then residency is optional for PAs, but right away you could just go straight into practicing.
For nurses, it's 4 years in total. So we have 2 years of prereqs and then 2 years in the program. I actually went into a fast track program, so mine was 3.5 years.
So not too bad. And you're
Yeah.
coming right out and you can start.
I
Right.
started as a nurse at 21,
All right.
right out of the gates.
So we'll put the numbers up here, the number of years in front of each of us.
Yeah.
Make your decision. Is it worth more or less?
Depends what you want, what your goal is,
Yeah.
and
totally
which
true.
area that you like to work in.
And what like your lifestyle, you like the kind of lifestyle you see yourself having. I mean, if you want to, if you're a female, a lot of the PA profession is female driven. Why? Because like they want to have a family and they want to have a professional career and they want to have like that perfect work-life balance. And I feel like with the PA profession, you can establish that with the nursing too. I mean, with everything, but the PA profession, like women tend to drive towards that because they want that balance.
I feel like I'm channeling my inner Dr. Boyd here, ER doc mom. She would say that you can have a great work-life balance as a doctor.
I agree.
I know that's a tough. I'm putting you in the tough spot just for fun, but I think there's a lot. No, I think you're spot on, right? My perspective of it as a very soon-to-be physician, looking at PA school, is that you do certainly get a lot more freedom. You get probably more free time once you're out. There's a little bit less like overhead stress from liability, right? You're working under a doctor technically. It's still their insurance that's covering you, so you kind of
Not
have.
really.
Is that different?
It's
Tell me about
it. So PAs can. So we took a course this summer, and that's what I thought also. I used to think that PAs like don't get sued, but PAs get sued. You have to have your malpractice insurance also, and if you do something wrong at work,
Right.
you get sued directly.
So learning something new every day. There's my fact for the day. I thought it was entirely on the doctor. So maybe that part's not as valid, but I think as a whole, you probably are going to have a better lifestyle as a PA. There's maybe just obviously less schooling, earlier time to making money in your life and making investments and getting a house and things like that.
Right.
So I think you get a lot earlier and you're still very independent.
Yes. So the one thing that the PA profession really underlines is having the balance of autonomy and collaboration. So of course you do work with the physician, the collaboration with the physician for the rest of your professional career, but most of the time you kind of call the shots on your own. But if you need further assistance, you always have someone to go to and kind of discuss and see what's going on with the patient, and that's the physician.
The average doctor, they said, was between only 165,000 up to like 200 and what was it, like
30, I think.
30,
Yeah.
230,000. So I can tell you that for emergency physicians, that's not right at all. The average last year was somewhere around $330,000 for an emergency medicine physician. Now, that obviously depends whether you're in academics. If you're in a city, a big city's more desirable. You're going to make less versus like a rural area. So there's a lot of factors, but I would say most physicians are more realistically north of $200,000. And obviously you have surgeons who can be making tons of money, well over 500. But what's it
Right.
looking like for PAs and then for nurses?
So for PAs, the average salary I think is between 105 and 116, but that goes up. There was a recent report for 2018 new grad PAs. They all the employment rate was 100%, and they started with, I think, 98,000. That was the average for starting new grad PA. But I think that number quickly rises up. I personally know PAs who make close to 200.
Wow.
Yeah.
That's good money.
Yeah, that is good money for, absolutely, I agree.
Well, nurses, I mean, we range from everything,
Yeah.
depending on where you work, what kind of nurse you are, what city you work in, and then how long you've been a nurse. So, but I would say on average for like a newer nurse, it's about 45,000 to 75,000 a year. So, but you just, and we get, we have holiday pay, we have weekend pay, we get special pay after 3 p.m. So, I mean, it just all goes.
I'm signing up where you work. Special pay after 3 p.m. That's like.
Yeah, I get it after, I think it's 3 p.m. for day shift and then after 3 a.m. for night shift.
So, what do nurses and PAs and doctors actually do? We're going to try and answer it for each other. So, for PAs, I think it's a team effort. I think you guys are probably like on the front lines a lot. Like I know in some places I've rotated, they literally have something called a front end provider, and that's PAs and NPs, and they're seeing the patients high flow, getting things started and getting them sent back to the physician. Now, there are PAs back in the department as well, working patients up start to finish, but it's nice to have that like advanced provider as a triage section. So I would kind of look at it as like, I hate the term physician extender. I think that's probably like not a popular term. But it's nice to think that like you have someone who's very well trained, who's able to go take care of patients and grab you if there's something that needs a little bit more help, but that they're also able to function on their own. That's kind of how I like see working with PAs and NPs.
I agree with that. I
Cool.
think so.
And I think for doctors that you guys kind of are like the commander in chief. You are always there for us. You kind of guide us. I would say we do like a lot of the hands-on, but you give us all the orders and kind of what you think the plan of care should be, and then we fulfill it and act it out. But I think for the most part as doctors, you guys are always there for us. You kind of run the show, which is a good thing. You need somebody who is a leader and can, one person or maybe two, depending on your hospital, that you can turn to and say, hey, this person is in charge, and that doesn't get mixed with where to go and who's in charge. And
I think that's spot on. That's kind of how I see the role too.
Right. And for nurses, I think like you guys are such an important key role in patient care because you guys are directly involved. Like you're always there with the patient when we are not. And I think you guys just make the floor running, make the hospital run and keep it going. You guys have a very important role.
Couldn't agree more. We could not do the job that we do without the help of the nurses. They're at the bedside all the time. Anytime a nurse tells me like, oh, hey, this is a change, I'm like, that's legit. Like, I wouldn't have seen it. I'm definitely taking your word for it. So I love when the nurses come up and give feedback. A lot of times I wish it was more. Like, there's a lot of times they'll come by and be like, oh, I didn't notice this change. They're like, oh, I didn't want to bother you. I'm like, no, please, like, I would love to hear about it if it's like a significant change. So you guys are awesome and always on it.
Yes.
Well, we all work together.
That's right. So. It's a team effort. All right, the last question. This one is the easiest. Who works the hardest?
The PAs.
Nurses.
Oh, no. The PAs.
Definitely the doctor. We have like 30 patients at a time.
I turn my patient every 2 hours.
Tell you what.
I clean their mouths.
Hold on. You guys settle this for us. Drop it down in the comments. Who works the hardest? Is it the doctor? Is it the PA? Is it the nurse? Here's a secret. We all work really hard. But we want to hear what you think. Drop it down in the comments. If you enjoyed today's video, be sure to give it a thumbs up and smash that subscribe button. Let us know. Let us know that you enjoyed these videos and you want to see more. And of course, make sure you turn the bell on so you don't miss a single video that we put out. Now, before you go, head on over to seethemedlife.com and pick up some merch. We have lots of cool stuff over there. Tote bags, great t-shirts, all sorts of cool stuff to pick up. You probably see them on the screen right now. Thank you again for watching today's video, and we'll see you in the next video.
Thank you.
Oh, God. I'm not that smart. I'm not gonna...
I don't know, just think of something creative.
No. We have a whole bloopers roll. Smash that subscribe button. Let us know.
Subscribe.
Don't forget
You're
to
like,
subscribe.
smash the like button and subscribe, and then also
And then
click,
smash
and
it
then you're
also.
like, then click that thumbs up and
All right,
subscribe.
whatever. All right, ready?
We just really want you to subscribe.
I really want you to subscribe. All right.
Please.